Well, my wife first suggested I might have a heart condition when I had tightness in my chest and some breathlessness, particularly in the morning. So she nagged me and I took a route to the local GP.
First, I find out when I was climbing the upstairs, I get more breath problem, breathing in. Then gradually, when I walk twice a day in morning and evening, and I couldn't walk when it is a high hill. So I had to sit down and take breath back because it was so tight near my chest.
I used to find walking uphill there was a tightness in my mouth that used to extend down to my chest. And on one occasion, I've had that sensation at rest, and it became extremely uncomfortable.
Do any of these symptoms sound familiar to you? If they do, you may have coronary heart disease and are likely to be referred to a rapid access chest pain clinic. This video provides you with information about the nature of coronary heart disease, the role of the rapid access chest pain clinic in diagnosing coronary heart disease, and the tests you're likely to undergo. Let's first consider your heart and the important role it plays. Every organ in your body needs to be supplied continuously with blood to function properly. Fresh blood brings oxygen to the tissues and carries away unwanted carbon dioxide and other waste products. The blood circulates around your body through a closed system of blood vessels. The heart pumps the blood around the body. It has 4 chambers and a one-way valve system. Each contraction or heartbeat pumps blood forward into the arteries. The arteries divide into smaller and smaller branches to supply a microscopic network of capillaries distributing the blood to every part of your body. Blood's then returned to your heart by the veins. This circulatory system is called the cardiovascular system. It contains about 8 pints or 3 3/4 litres of blood which your heart is continuously recirculating. Each day your heart beats about 100,000 times and pumps about 5,000 gallons, that's over 22,500 litres of blood. The heart is in fact 2 separate pumps which work together. The right side of the heart receives dark, deoxygenated blood which is circulated around the body. It pumps this through the lungs where it picks up fresh oxygen and releases carbon dioxide and becomes bright red again. The left side of the heart receives oxygen-rich blood from the lungs and pumps it through the aorta to the body. The heart wall is made up of a special sort of muscle called the myocardium. And like every other living tissue, the myocardium itself needs to be continuously supplied with fresh blood and oxygen. This supply of blood comes from the coronary arteries. When the coronary arteries supplying the heart become narrowed, the heart muscle doesn't get an adequate blood supply, and physical symptoms such as tightness or discomfort or pain in the chest are often felt. Most heart conditions diagnosed following a visit to a rapid access chest pain clinic are related to coronary heart disease. Angina and atherosclerosis are terms you may have heard of or have discussed with your doctor. Coronary heart disease is caused by a build-up of fatty deposits called plaque on the inside of the walls of your coronary arteries, the blood vessels that supply the oxygen-rich blood to the heart muscle. This process is called atherosclerosis, or is sometimes known as hardening of the arteries. The plaques decrease the space through which the blood can flow. Poor blood flow can starve the heart muscle and lead to chest pain. A heart attack results when blood flow is suddenly completely blocked. This usually occurs when a blood clot forms over a plaque that's ruptured.
On describing my symptoms, the doctor clearly felt that there was a heart condition to explore. She immediately arranged for me to have an ECG test and a blood test, the results of which, the blood test initially were that I had a high cholesterol level, something between 7 and 8, and she wanted to bring that down. And also, although the ECG was fairly okay, The results, that is, she did prescribe me some aspirin to regulate and control that, whilst referring me to the chest pain clinic.
I got terrible pain, and I was talking to my sister-in-law about it, so she concerned. So she said, let's go and find out from the GP what is it, So she come with me, and doctor suggested to send me to the hospital to check out.
On my arrival, the nurse asked me for my symptoms. Once I'd explained these to her, she did some blood tests, they did an ECG, and they also checked my blood pressure. Once the results of these had come through, a doctor saw me, and he told me that I had coronary heart disease.
Majority of patients who are presenting to my surgery tend to present with central chest discomfort, or what they would describe as pain. Often that will radiate to the jaw, particularly if it's more heart-related pain, but they may also describe symptoms of nausea, sickness, sweating, and palpitations are very, very common symptoms. Some patients will certainly need further investigation and referral on to a rapid access chest pain clinic. What I do in general practice is to fill in an A4 sheet which is provided by the chest pain clinic, and on that I normally fill in just the patient's details and a brief outline of their presenting symptoms and medication, as well as any relevant past history, and then I fax that form through to the chest pain clinic, who will endeavour to set up an appointment by contacting the patient directly as soon as is convenient.
The commonest cause of chest pain for which general practitioners are expecting to refer patients to chest pain clinics is suspicion of angina, in other words, heart chest pain caused by shortage of blood supply to the heart. But of course there are other causes of chest pain, and it's often to exclude heart disease that patients are referred to the chest pain clinic. Hence many patients will be reassured by their visit to the chest pain clinic and be advised that they don't have any evidence of underlying cardiac causes for chest pain. But if the chest pain clinic confirms that there appears to be shortage of blood supply to the heart, in other words, the patient has angina, then the underlying cause of that is normally furring up of the coronary arteries, or coronary arteriosclerosis, or coronary atheroma as it is otherwise termed. And the reasons why people get furring up of the coronary arteries is fundamentally not known precisely, but the risk factors for the development of furring up the arteries are well known, and they include smoking, high cholesterol, high blood pressure, diabetes, amongst other factors. All chest pain is not a reflection of heart disease, and not all heart disease causes chest pain. So there's a very important clinical element in the assessment of any patient. It's taking a history, which is done by a general practitioner and hospital doctors, specialist nurses, and so forth. And this history is very important in determining the likelihood of any symptom being due to underlying heart disease. And then after that there is an examination, a clinical examination, and then finally investigations such as are undertaken at the chest pain clinic, like treadmill exercise testing. And it's putting all those things together, the history, the examination, and the investigations, that leads to a conclusion. And the conclusion isn't simply based on one of those different aspects.
The reason why you've been asked to attend a rapid access chest pain clinic is to find out if your symptoms are due to narrowing of your coronary arteries. Depending on where you live, you may normally be notified by an appointment by telephone within a few days of the referral. A letter confirming the appointment will usually be sent together with an information leaflet telling you what's likely to happen at the clinic. Since you're likely to be asked to take an exercise test, you'll probably be asked to bring soft shoes and comfortable clothing.
Morning.
Morning, my name's Terry Smith.
Here for the chest pain clinic?
That's right.
On the day of the appointment, you'll be seen by a chest pain specialist who will assess your suitability for any tests to be undertaken.
Okay, Mr. Smith, now your GP wrote to us a few days ago saying that you've been having some chest pain. If you'd like to tell me a little bit more about that.
They will then ask you about your medical history and any current treatment, allergies, smoking and alcohol consumption, as well as information on past medical, family and social histories. Then your blood pressure and pulse will be recorded, and you may have a brief examination using a stethoscope. Next comes a resting electrocardiogram. This is better known as an ECG. This records the electrical activity of your heart. A resting ECG is taken while you are either sitting or standing at rest. The electrical signals produced by the heart can be detected through the skin by small metal discs called electrodes. Areas on the arms, legs and chest where electrodes will be placed are cleaned and may be shaved to provide a good contact surface for the electrode discs. Several electrodes are attached to the chest with an adhesive. The electrodes are then connected with long wires to an ECG machine which will record your heart's electrical activity. The ECG machine prints out a record of the electrical activity as line tracings on paper. These tracings are analysed to spot abnormalities before taking an exercise test. The resting ECG is done before the exercise test because certain abnormalities on the resting ECG may make an exercise test more difficult to interpret. Also, a resting ECG may indicate that an exercise test may be unsafe. If your resting ECG is satisfactory, then the next step will be an exercise test. This will evaluate how your heart responds to the demands of physical activity. In addition to the electrodes, a blood pressure cuff is wrapped snugly around the upper arm so that the blood pressure can be checked every few minutes during the test. To exercise, you'll either pedal on a stationary bicycle or, as in this video, walk on a treadmill whilst being monitored by an ECG machine. The test is usually performed in a series of stages. Each stage usually lasts about 3 minutes. At the end of each stage, the ECG is recorded. After each stage, the resistance or speed of the treadmill is increased.
Any minute now, speed is going to increase and it's going to get a bit steeper.
At first, it'll move slowly on a level or slightly inclined position, and as the test progresses, the speed and steepness of the treadmill will be increased so that you'll be walking faster and at a greater incline.
Feeling okay?
Yeah, no, I'm working a bit harder now.
A maximum safe heart rate is calculated for your age, and the test will continue until either you reach this heart rate or until you feel the need to stop. Alternatively, the staff may stop the test if your ECG shows evidence of decreased blood flow to the heart muscle. The test may also be stopped if you develop a serious rhythm disturbance or if your blood pressure falls.
Okay, let's come and sit down then, Mr. Smith. Long and rest.
When the exercise phase is completed, you'll be asked to sit or lie down and rest. Your ECG and blood pressure will be checked for about 5 to 10 minutes during this recovery period.
That's the end of the test.
The electrodes are then removed and the test is complete. From start to finish, the entire test usually takes between 15 to 30 minutes.
Well, it initially was gentle, of course. The treadmill is slowly ramped up to higher speeds, and all the while checks being made on your heart and pulse, etc., etc. It was quite an effort. It's something that you try to fight, I suppose, in a way. And the results for me anyway were fairly okay, but despite that, the doctor referred me to the hospital for an angiogram.
When your heart is relaxed, it may receive sufficient blood through the coronary arteries even if they are narrowed by plaque. But when the heart has to work harder, such as during exercise, it requires more blood, and the narrowed arteries may not be able to supply the amount of blood required. If a part of the heart is affected by poor blood flow, the ECG may show characteristic abnormalities during exercise. These abnormalities are often not present on an ECG taken during rest. Some people will be unable to take an exercise test for a variety of reasons. For example, they may have arthritis and not be able to exercise, or their blood pressure may be found to be unacceptably high. And in any case, if any readings either before or during the test indicate problems, then you'll be asked to stop and rest.